afternoon. My name is Michaela Etheridge, and I'm a student nurse at the University of South Alabama's College of Nursing, and this is my indwelling urinary catheter insertion video. So the first thing I'm going to do is verify my order and verify my hospital's policy. Then I'm going to perform hand hygiene and verify that this is my patient using two identifiers. So Jaguar Jones, MR number 4176352, MR number 4176352. I'm going to assess the allergies. So on the chart we have allergies penicillin and allergies penicillin, and I would ask the patient if there were any other allergies that I needed to know about. Then I would explain the procedure to the patient to relieve any anxiety, and I would look on my chart to find the justification for why we are giving an indwelling catheter. So some 3 reasons would be required immobilization for surgery, trauma, or other therapies, strict urinary output monitoring as indicated by the plan of care, and to assist in healing of open sacral or perineal wounds in incontinent patients. So those are 3 reasons why we would give an indwelling catheter. Then I'm going to provide privacy for the patient by closing a curtain or a door to make sure that they are comfortable. Then I'm going to gather all of my equipment, which I've already done. I've gathered all of my equipment and placed it over here. I'm going to don my goggles. I'm going to position my trash can, and I'm going to perform hand hygiene. I will then raise my bed to a working height for myself, lower the side rails, and place my position in a dorsal recumbent position with the legs slightly bent so that there is enough room for the a sterile kit and sterile drape. Then I'm going to provide perineal care. So I'm going to perform hand hygiene and put on clean gloves. For a female, I'm going to wash with soap and water. So I'm going to do the upper inner thighs. Then I'm going to do the labia majora. So I'm going to, from front to back, do one side, and then with a new washcloth or a rag or a different part of the washcloth, do the other side from front to back. And then I'm going to spread the labia, and I'm going to clean the inside. So I'm going to clean from the pubis to the rectum. So I'm going to clean farthest away, closest to me, and down the middle. And I'm just going to make sure that I get all areas from the pubis to the rectum, so the clitoris, the labias, and the any vaginal orifices. So I'll just clean that, and then I'm going to pat it dry. And for a male, I'm going to grab the shaft. I'm going to clean the glans penis. I'm going to start with the urethral meatus in circular motions. I'm going to go in circular motions. I'm going to do that until it's clean, and each time that I repeat that circular motion step, I'm going to use a new washcloth each time. So from the urethral meatus, back, then the shaft and the scrotum, and I'm just going to make sure that I get all areas very clean and make sure everything's clean, and then pat it dry, because perineal care is very important to making sure that the perineal area is not contaminated before insertion of the catheter. So then I'm going to get my catheter kit. I'm going to place it in between my patient's leg. I'm going to use the outer package as a trash can and place it where my patient's hip is on the bed. I'm going to open my kit. So I'm going to go away from me, the middle pieces, and towards me. Then I'm going to perform hand hygiene, and I'm going to don my sterile gloves. So I'm just moving my computer so that you can see me donning my sterile gloves. So I have my package. I'm going to open my package, only touching the outside. I'm going to put my dominant hand on first. then the non-dominant hand, so I'm about to break sterility by moving my computer, but you have to see what I'm doing, so I'm just going to move my computer back to where it was to make sure that you can see everything I'm doing. So that was a break in sterility, but I had to. So I'm going to remove my sterile drape, and I'm going to place it in between the patient's legs, close to the perineal area, with the shiny side down. Making sure not to break sterility. So I'm going to make sure that there is no gap between the sterile kit and the sterile field, and there's not a gap between the perineal area and the bed. So first I'm going to remove my plastic kit and place it on my sterile field. I'm going to get everything ready on my sterile field. So I'm going to get my iodine swabs. I'm going to open it and lay them out onto my plastic container. I'm going to get my lubricant. I'm going to open it. I'm going to place it in the spot for the lubricant. I'm going to get my 10 milliliter water-filled syringe, and I'm going to connect it to my balloon port. So now that I have it connected to my balloon port, I'm going to lubricate the catheter. So I'm going to lubricate, well, I will remove the plastic wrap, but it's already moved. So I'm going to lubricate the first 1 to 2 inches of the catheter for female, and the first 5 to 7 inches for male. Then I'm going to begin the cleansing process. So I'm going to open the labia. I'm going to get my iodine swabs. With my non-dominant hand, I'm opening. I'm going to cleanse farthest away from me around the urethral opening. I'm going to cleanse closest to me around the urethral opening. And I'm going to cleanse down the middle. For a male patient, I would clean around the glans penis, starting at the urethral meatus in circular motions and going back 3 times until it's clean. Now I'm going to tell my patient, I'm going to move my box closer to the patient, and I'm going to tell them that I'm about to begin with the procedure. So I'm going to need them to bear down as if they were voiding, or I'm going to need them to take a deep breath and exhale and hold it while inserting. And for a male, their penis is going to be perpendicular in a perpendicular position from their body, and we're going to use traction when inserting. So I'm going to pick up my catheter with my dominant hand. I'm going to insert until I get urine return. Once I get urine return, I'm going to insert 1 to 2 more inches for a female, and I'm going to insert all the way to the bifurcation for male. So I'm going to hold that with my non-dominant hand, and I'm going to insert the, I'm going to fill up the balloon. So my syringe came off, but I'm going to try to insert it back on anyway. And I'm going to inflate my balloon all the way. Once I have inflated all the way, I'm going to remove my syringe from the balloon port. I'm going to pull back until I feel resistance. And then I'm going to place it in, slightly advance it in some more. Now I'm going to show you how to keep it in place with a lure lock, a stat lock. So I'm going to, since it's in place now, I can remove my hand. So here's a stat lock. For that, we will follow the instructions for cleaning the area and placing. So you'll just remove the sticky and place it on the inside of the patient's thigh. And you're going to do this to make sure that no trauma comes to the patient's urethra while we get positioned to a new position. So you're going to place it onto the patient's inner thigh. You're going to open up the stat lock. So you just press the button and open. And there's a place to hold the bifurcation. So there's a place for the big part and the small part. And then you just clip it closed. Once it's clipped closed, you're going to make sure that you have slack so that when the patient gets put back into a different position or moves, there is no trauma come to the urethra. That's the whole point of keeping this in place and where it is located. So to remove, you're just going to press the button and open. And that's how you remove from the stat lock. So now that I have shown you how to remove it from the stat lock, I'm going to show you how to take a sterile specimen collection from the bag and from the collection port. So here is my going to be my bed rail. So I'm not going to put the bag above the patient's bladder. I'm going to make sure that the bag is hung below the patient's bladder. I'm going to make sure that it's hung on the bed frame, not the bed rail. And I'm going to hang it on my chair. So now I'm going to show you how to take a sterile specimen collection first from the bag. So I have my bag here. And I'm going to get my specimen container. I'm going to open the cap upwards and keep it up. So I'm going to remove this piece from the bag. When putting the urine into the container, I'm going to turn it up, make sure it's above the container but not touching the container or touching the inside. I'm going to flip it open so urine comes out, and then I'm going to close it back once my container is filled. I'm going to place this back into the bag. And I'm going to close my container. Then I will fill out the label for everything that's on here to make sure that I know what this urine sample, who it's for, and when it was done. So now I'm going to show you how to get it from the collection port. So you're going to get your container, open it, making sure that you keep the top up so that it's sterile. So for this specific collection port, I would need a syringe with a needle, but I do not have one, so I'm just going to pretend. So I'm going to clamp the tube. I'm going to get my syringe and I'm going to insert it into the collection port. I'm going to remove the urine into my syringe. I'm going to pour it, plunge it into my container, making sure not to touch the container with the syringe. And I'm going to slowly put it in so that it does not splash. I'm going to unclamp the tubing, and I'm going to close my sterile container. And I would then label again. So now that I'm done with that, I can now clean up all of my supplies and throw them into the trash can. I'm going to remove my gloves. So we're going to go glove to glove and skin to skin. I'm going to place the bed all the way back down. I'm going to raise the side rail. I'm going to make sure that the patient has the call light in reach. I'm going to make sure that they're comfortable. I'm going to make sure that they have all their comfortable equipment that they need. Then I'm going to perform hand hygiene, and I'm going to leave the room. Then I'm going to go and I'm going to document. So I'm going to document the amount, the color and consistency of the urine, the size of the NG tube, how the patient reacted to the procedure, and whether or not I took a specimen collection. I'm also going to describe the daily catheter care procedure. So I would basically be doing perineal care, but with a catheter inserted. So I'm going to make sure when doing care not to put any tension on the catheter, and to make sure to thoroughly clean around the area of the catheter. Then I would plan to have the catheter removed as soon as medically indicated. Now I'm going to show you how to discontinue an indwelling catheter. So to discontinue, I'm going to go back in the room, and using aseptic techniques, I'm going to perform hand hygiene. I'm going to put on some clean gloves. And I'm going to describe to you how to remove the urine from the bag and put it into and measure it. So I would get my bag here. I'm going to remove the urine just like I did for the specimen collection. I'm going to put it into my graduated cylinder. Once it's empty and I have it in my graduated cylinder, I'm going to measure the amount of urine from there. So now I would loosen my plunger, my 10 milliliter plunger. I would pull it back half a milliliter. And I'm going to connect it to the balloon port, and I'm going to let the water come out using gravity. And make sure that I get all of my water back. Once I've done that, I'm going to remove the catheter. I'm going to perform perineal care, and I'm going to go and document. So I'm going to perform hand hygiene, and I'm going to go document. I'm going to document the amount, color, consistency, and odor of the urine, the intactment of the tip of the catheter, how the patient tolerated the procedure, how much I measured, and I'm going to document that I taught signs of a UTI. So that would be dizziness, that would be fever, chills, flank pain, back pain, and frequency and urgency to urinate. And then I would come back and assess if my patient had voided in 4 to 6 hours, and if they had not, then I would palpate the bladder or get a bladder scan. And that is all.